Hi, my name is Alexa McDonald, and I'm the clinical and sports dietitian at Princeton University. Binge drinking is often not uncommon on a college campus, or for that matter, among sports teams. A 2005 NCAA study surveyed almost 20,000 college student athletes between 1993 and 2005 indicated that almost 75% of D1 student athletes consume alcohol, and about 60% of them believe that their alcohol use has limited to no effect on their performance and overall health. Within this study, males and members of team sports in particular reported the highest incidences of binge drinking. The 2015 Dietary Guidelines recommends that if you choose to drink, you should do so in moderation. So what exactly does this mean? About 1 drink per day for females and 2 drinks per day for males. On the other hand, heavy or high-risk drinking is defined by more than 3 drinks per day or 7 drinks per week for women, and more than 4 drinks per day and 14 drinks per week for men. Binge drinking in particular is considered more than 4 drinks within 4 hours for women and more than 5 drinks within 4 hours for men. 1 drink, as referenced by the Dietary Guidelines, is considered equal to 12 fluid ounces of beer, 5 ounces of wine, or 1.5 fluid ounces of liquor, which each contain about 14 grams or 0.6 ounces of ethanol. Heavy drinking has been associated with higher rates of high blood pressure, liver disease, certain forms of cancer, motor vehicle accidents, injuries, violence, and accidental deaths. Prior to the early 1980s, alcohol was thought to have some ergogenic effects. Although the variability between doses, exercise type, and individual intolerance within study makes this topic hard to study, it has been concluded that alcohol only has negative impacts on performance. When it comes to drinking during a recovery period, small amounts of alcohol post-exercise will likely have limited to no effect on adequate recovery, including glycogen repletion, rehydration, and muscle recovery from injury. However, this is absolutely only the case when priority is given to recovery and adequate fluid and nutrient intakes at the appropriate times, whereas higher, more hazardous doses can have both immediate and long-term effects on physical, psychological, and social health and should be avoided. Alcohol functions as a diuretic and can't be used to fuel or refuel the muscles. Therefore, without proper attention paid to recovery, rehydration and energy stores will be affected. Heavy alcohol consumption can also increase the risk for injury and illness due to a depressed immune function, causing of increased swelling after injury and delayed healing. Alcohol intake should be absolutely avoided after injury. Regular alcohol consumption or heavy intakes can also lead to undesired weight gain and negative body composition changes. Over the long term, heavy alcohol consumption can result in nutritional deficiencies, organ impairment, altered digestion, absorption, and metabolism, muscle damage and wasting, and weakness. An impaired ability for muscle and strength gains will also result. It can also reduce testosterone levels, which has a direct impact on protein synthesis and muscle growth. One important thought when it comes to alcohol is, what is it replacing? Alcohol is a calorically dense, nutritionally poor substance with mainly negative effects on our overall health. If it's replacing important nutrients like carbohydrates and fluids, it will hinder recovery and ultimately your performance. Limited effects on performance have been noted when alcohol is a function of minor addition instead of replacement or major intake. However, this can still lead to the concern for undesired weight gain and potential performance effects.